Thanks to just one bipolar depressive episode, which went on for years, I gained weight rapidly. I went from a healthy 180 pounds to a peak of 354 pounds in just an incredibly short amount of time. That's 174 pounds of weight gain. What's up, everyone? My name is Tyler Adelpho. I'm 27 years old, and I have a diagnosis of bipolar type 1 with psychotic features. In this video, I want to talk about some of the challenges that come along with having bipolar disorder as it relates to weight management. And I'm going to share some insights I've learned, some tips that I'm now utilizing in order to lose weight. Not to brag or anything, but I did just lose 7 pounds in the last 13 days, and I'm proud of that, and I'm proud of the progress I'm making, and I'm proud that I'm going in the right direction. This is a long time coming for me. Now, I currently weigh 327. I went from 334 to 327 in 13 days. Let's start off with some of the challenges that come along with bipolar disorder. I think the first thing, the most important thing, is understand that you're going to have to work harder than people who don't have bipolar disorder, than the general population that doesn't suffer from rare mental illnesses. And the reason for that, well, there's many reasons for that. There's the medications that we take, which have side effects of weight gain. There's also the different mood episodes we experience and how they can impact our behaviors in detrimental ways, whether it be mania or depression. For me, I actually didn't gain weight during mania because I just had so much energy and I was really walking everywhere as a way to try to use that pent up energy that I had. It was during my depression that I put on weight exponentially. And the reason for that is I was dealing with a lot of fear, doubt, shame, and uncertainty as a result of the manic episode that I experienced. For those who are new to my channel, I suffered from a 6 month long bipolar manic episode during which I experienced very powerful delusions, lost control of my central command center, and suffered a variety of consequences, including getting kicked out of my university, losing jobs, and destroying a lot of the relationships that took me years to build. So, the challenge of exercising through depression is one that presents itself to those of us who have bipolar disorder. And man, it is a daunting task. Because let me tell you, when I was dealing with moderate to severe depression, I'm currently in like a light to moderate, fluctuating in between those, but mostly in a light state, and I'm very fortunate for that. But when I was in that moderate to severe state, fluctuating between those extremes, I suffered from anhedonia. I struggled to find enjoyment in the things that I would typically enjoy, and I couldn't find the motivation to do anything. I would go month-long periods of not leaving my house. The only time I left my house was oftentimes to go to medical appointments. And just think about how depressing that is in itself. Environment contributes a great deal to the way that we feel about ourselves. That's one thing that I've learned is very crucial is our environment and the factors that are contributing to our health. Environment is a huge one. So in order to persist through depression, what I had to do is I had to start thinking in terms of the big picture. I don't want to suffer from deadly preventable diseases as a result of being severely obese, of being morbidly obese. And so I want to take the small steps, proactive steps necessary in order to mitigate the probability of me suffering from these deadly preventable diseases. I want to be healthy again. I don't want to be in this position where I'm overweight for the rest of my life. And the odds are quite scary. I will attest to that. From what I read, only 1 in 1,290 men who reach the state of morbid obesity will return to a normal body weight in any given year. 1 out of 1,290. But I'll tell you what, I intend to be that one, and I'm going to share the methods and strategies that I will be using in order to get there. But before we get that, I want to put some more emphasis and draw your attention to medications. Now, medication saved my life, no question about it. The pros outweigh the cons for me, no question about it. If it wasn't for my medications, I would have never left the state of mania. I truly believe that I would have lost my life at one point. Because of Abilify, I actually pulled myself out of mania very speedily. But it was in that time period, that intersection between the end of mania and the beginning of depression, that I started to feel that guilt, fear, shame, self doubt as a result of embarrassing things that I said and did during mania and the consequences of my mania. The unfortunate aspect of these medications is that of a lot of the medications I've been on, including the ones I'm on now, have light to moderate weight gain as listed side effects. And of course, that presents the challenge and the decision that you have to make with bipolar disorder is you want to maintain your sanity. I would argue that that's more important than anything else. Nothing else matters if you don't have control of your central command center. But it comes with increased probability of overeating to cope with depression. It comes with, a lower probability of exercising because of the fatigue that you may feel or the tiredness you may feel as a result of your medications. I take antipsychotic, I take mood stabilizer, and I take antidepressant. The trifecta of these three all culminate. And even though they each only have light to moderate weight gain as a side effect, when you combine these three things, it results in massive amounts of weight gain if you don't monitor yourself closely. And that's my warning to people out there with bipolar disorder. Maybe you just had a manic episode. Maybe you're now in a depressive episode. Watch your weight because it will increase so fast if you don't monitor it and if you don't make the right decisions in the kitchen and exercising. I'll share a quick story. I remember just a few months into my psychiatric treatment after my manic episode, my psychiatrist commented that she's concerned about my weight, and it's because I just put it on and it was so visible. How quickly I put it on made it so visible to the eyes of others. My appearance changed so much. I didn't recognize myself in the mirror anymore. When I look at old photos, I truly don't recognize myself. It looks like a different person. And that's sad to me. I don't want that to be the case forever, but it happened. And another story relating to my psychiatrist noticing my weight gain is noticing that clothes no longer fit and the struggles to find clothes that do fit. My size currently is 3X. I have lots of large XL, 2XL that no longer fit. And it's very frustrating. And I want to fit into those clothes again because it's a self-esteem issue. I do care about how other people view me. I don't want people to think I'm lazy. I don't want people to think that I'm apathetic and don't care about my life. Of course I do. I have my hardships, I have my trials and dark chapters that make it more difficult to do those things. But ultimately, I do care. And so now I'd like to transition and draw your attention to the things that I'm going to be doing, that I am doing in order to lose weight. How did I lose 7 pounds in these last 13 days? I think the biggest thing is that I've been eating smaller portions. So regardless of what your diet is, I feel like eating smaller portions is crucial because that's the best way to reduce your caloric intake. And when you reduce the number of calories you consume, that's calories that then go towards weight loss. It takes about 3,500 calories to burn a pound. And it's a lot easier to not eat 1,000 calories of ice cream than it is to burn 1,000 calories on the treadmill. A lot easier. I can attest to that from my own lived experience, and I'm sure a lot of people can relate. So eating smaller portions is one significant component of my plan. Another thing that I'm doing is I'm staying away from sugary drinks. I previously drank voluminous amounts of soda, and soda, as you know, is abundant with sugar. And you don't want your body to be burning sugar, you want your body to be burning fat. And sugar is highly addictive. We can truly never get enough of it. We always want more. The average American is consuming far more sugar than they should. I saw a statistic that 70% of Americans are either overweight or obese. So if you're experiencing this and if you're overweight or you're obese, please know you're not alone. It's a struggle that a lot of people face. Don't let those people who pass judgment on you get inside your head or live rent-free in your head. Because I'll tell you what, those people are the minority, the ones who are a healthy weight. The majority, the vast majority of Americans are struggling with their weight management. But staying away from sugary drinks can be huge because Drinks, I feel like, and I'm not sure if there's much science behind this, but I can personally say that my body, sugary drinks don't fill me up as much as a delicious meal does of solid food. And the calories that come from a drink go down quickly. It's never enough to have one cup. Pretty soon you're on your fifth cup or your seventh can. And it's just so tremendously difficult to lose weight when you're just constantly swimming in sugary calories. Of course, a major component of my weight loss plan, and this shouldn't be a surprise to anybody, is exercise. There's a saying that I heard once that if the effects of exercise could be prescribed in a bottle, it would be the most effective antidepressant in the world. And I truly believe that. The happiest periods of my life have been when I exercised consistently, when I got up and was diligent and committed towards getting an exercise session done, when I had an exercise routine and regimen in place in my life. Those are the periods of my life where I've been at my happiest. So, not only the cognitive mental benefits, but of course the physical benefits. Exercise has been studied and shown to boost your metabolism. And when you augment your metabolism, it means that it expedites your weight loss progress. It allows you to more efficiently manage your weight. Now, this last one I think will surprise you of what I'm using to help me with weight loss, and that is therapy. I know it's successful for some people more than others. Some people might derive no benefit from it, but I would argue that a lot of people could stand to gain from it if they gave it a chance. And because a therapist presents you oftentimes with what's known as cognitive behavioral therapy and will teach you coping mechanisms and strategies that help alleviate stress, which might lead to overeating or other behaviors that contribute to weight gain. So I'm using my therapy as an empowerment tool as well, and utilizing the advice that I learn from the sessions in my partial program to learn how to better cope instead of resorting to overeating or instead of laying in bed all day. Finding hobbies, finding things to do, moving my body, eating less. These are all things that contribute to getting you to a healthy weight. So, again, please don't feel alone if you're dealing with this problem. It's one that far more people deal with than many would like to admit. And we can all change. Nothing is immutable. Everything is subject to change. Just because you're at a weight you're not happy with now, it doesn't mean you'll be at that weight in the future. You have the ability. You are competent enough. You are good enough. God gave everyone a sense of purpose in this world, and you have what it takes to get those pounds off, I promise you. And I know that I do as well. And that's exactly what I intend to do.